Hi, my name is Mariah. I'm a medical assistant here at Allure. I'm going to demonstrate how to set up a MFT tray for the provider to use during an MFT procedure. Okay, so these are the supplies we need for the MFT tray. This is our polydocanol 3%. This is our STS, or sodium tetradicyl sulfate. We need gloves to put on, and this purple placemat. We also use 4 27 gauge needles and 4 30 gauge needles, a 3 cc syringe, a stopcock, and alcohol swabs. So first you put your gloves on. Okay, I'm going to scoot this stuff aside for a minute. You open up the purple bib. And then we set our 4 30 gauge needles down, 4 27 gauge needles. I usually set 4 alcohol swabs. Open the 3 cc syringe, remove the needle. You can dispose of the needle. Draw your syringe back to 2 cc's of air. Open our stopcock. The stopcock has 3 ways. We're going to turn the knob here to the one that looks different from the other one. So we're going to turn it this way, and that closes that one off. Then we're going to remove these, and we attach the 3 cc syringe with air to one of the 2, it doesn't matter, sides on the stopcock. Place it on your mat, and that's how the mat should be set up. Usually we fold it over and then set it on the counter every time we flip a room. When your provider comes in for an MFT, you would grab your 2 trays of medication out of the cupboard and set them out. And then whichever they choose to use, depending on the vein, you would set it on the mat for them as well. I'm going to demonstrate the MA portion of MFT procedure today. Hi Mary, my name is Mariah. I'm going to be taking care of you today. How are you feeling?
I'm fine, thank you.
Good. How are your legs doing?
They're good.
Good. Any new symptoms since we've seen you last time?
No.
Okay.
Thanks well.
Good. All right. Any medical changes or changes in medication?
No.
Any new allergies we should be aware of?
No.
Okay. Any chest pain, shortness of breath, fever, or nausea?
No.
Okay. All right, so now we take the patient's vitals. Okay, so we always want to make sure that the patient is sitting on the edge of the bed. We want both of their feet on the floor and uncrossed. And we go ahead and put this on their arm. Like so, and then I always elevate the arm as well. We're going to start the blood pressure. It's going to get a little tight on your arm here. Okay, we're going to take it off. Her blood pressure is 114/78. Her pulse rate's 89. So we're going to set this aside. And we're also going to take the patient's temperature in their ear. Thermometer should beep when it's ready. And then you insert it in the ear, press the button, and it'll beep again when it's ready. 98.6. That's great. And that finishes the vital portion of the medical assistant's job.
Hi, my name is Katie. I'm one of the registered vascular technologists here at Allure Vein Center, and today we are going to have a training video for the microfoam therapy, which are the ultrasound guided sclerotherapy injections. I've already washed my hands, so I'm going to put my gloves on, and I have my warm gel from the gel warmer. I'm going to raise the patient up to my height. Patient already has a wedge under her leg and her leg turned out to the side, and now I'm going to take a towel and put it up under her shorts and under her undergarments. I've already post-op scanned my patient since we completed all of her laser ablations. We always do a post-op scan ruling out for DVT. So now I applied my warm gel, I'm just spreading it around. I'm going to follow her greater saphenous vein which we ablated months ago. It is a little partial proximally. As we move distal, it is closed, and there's a nice large branch that comes off. And so today we are going to target the branches that come off the greater saphenous vein in the thigh. So just scanning, looking for other branches. I'm going to take my marker. I'm going to mark at the side of my probe where the branches come off and where we'll be injecting today. So, and then now we will let the provider know that we're ready for the injections. Okay, provider.
Are you doing like telling them about the 2 different medications?
Mm-mm.
Okay.
So now that the provider is here in the room, while she is mixing up her medication, I'm going to find my injection site. And I have it at the side of my probe, and I'm going to move it to the right side of the screen. The provider will come from the patient's left side to reach this vein.
The medical assistant flashes.
I'm gonna have a
for
little
them.
poke here. 1, 2, 3.
Flash.
The medical assistant is looking for a flash in the syringe, instead let the provider know that they are indeed in the
1.5.
vein. And now I'm going to scan proximal to look for the medicine to travel. It looks good. I'm going to come down and find our next spot, and there is some medicine that is traveling into our next spot. So I'm going to find another spot in an open vessel.
Sensitive area here. 1,
And
2,
if
3,
they'll
quick poke.
I'm staying nice and still so the provider can find the vessel that she's going to inject in.
Flash.
Are you doing okay, Mary?
Yeah, okay.
Good.
2.
And again, just looking for travel of the medication, seeing how far it goes. And it travels distal. I did notice that she had an anterior branch that came off at her junction. So I'm going to follow this branch down, and we're going to inject this one now.
Little poke here. 1, 2, 3.
We're targeting branches that are 2.5 millimeters and larger,
Flash.
and that are diseased or varicose branches.
0.5.
After each injection, the provider lets the medical assistant know the amount of medication that they injected at each site. And it's the medical assistant's responsibility to keep track of the amount given.
Another little poke here. 1, 2, 3.
Flash. Still doing okay, Mary?
Yep, doing good.
I'm going to leave you and look, and that's good.
1.5.
I'm leaving the provider and looking for travel of the medication.
Half.
And we used 5.5 cc's, and that is our maximum for today. So when the provider is injecting, I'm holding the probe and I'm tucking my fingers under, and I'm resting it on the patient's leg. So it's going to assure that the probe is not going to move anywhere, as well as stabilizing my hand. And it keeps my fingers out of the way so I don't get poked. And then I can still scan up and down and allows nice stability. So, and that's it for our injections. And now I'm going to wipe off the patient's leg. How are you feeling?
I'm good.
Good. So we're gonna have you do walking. Okay, you're gonna walk for 20 minutes.
All right.
And then we want you walking for 20 minutes 3 times today.
Okay.
I wipe my probe off with my towel, and then I'm going to use one of the sauna wipes to wipe my probe off for final cleaning. And then I'll remove my gloves and I will wash my hands. And that's it.